Good morning everyone. Welcome to our lower back myofascial release workshop or class today. So today we're just going to work through some general movement and articulation and then some specific myofascial release on the legs and through the lower back. So it's important when we do myofascial release that we really do the techniques quite slowly and move through the full range. So what we're trying to do in a myofascial release is release that fascia that's preventing that glider movement for the muscle. So the fascia is the connective tissue that lines all the muscles, and if we can really work through that fascia, we can prevent those restrictions and get the mobility back through that area and through that muscle. So it's important to do the full length the whole way through and to do it slowly. So we'll go through techniques at the same time. I've got the roller today and the spiky ball. Okay, so we're going to start in general just some movement through that lower back and to warm it up and to get movement through those legs as well. So we're going to start off with our 4-point kneeling. Okay, so we're going to go, remember in our 4-point kneeling that we've got our wrists right underneath our shoulders there, and our knees underneath our hips. Okay, so we're nice and neutral through here. Okay, make sure you're not locking out into those elbows, just nice and soft. Now we're going to start with the cat and camel. Okay, so we're going to just articulate and move through this whole range through your spine. Okay, so we start off with the in-breath. Okay, so we breathe in through our nose and we're really scooping up. Okay, so I always feel in this movement with our head down here is that someone's got almost a rope around here and the strings attached to the roof, and we're really trying to scoop that up. Okay, really press this whole spine coming up to the roof. So that's on our inhale, we really pull up, really flex in and tuck under that pelvis, and on the exhale we're going to extend out. Arching that back, taking it past neutral and taking into extension. In breath here, inching up, and exhale, extending. So taking this spine, the whole range, okay, the whole way through, and release. That's it. Now remember, in this release position, you're not releasing the whole lot. Okay, you're still having that nice support through your shoulders and your arms. Okay, so you haven't collapsed through there. Just concentrate on what's happening and articulating through that spine. You do 4 more. And breathe in. And exhale. And in. Really reaching for the roof. Keeping that support through the shoulders, arching through there, neck comes up, and scooping up, and out. Nice. And one more time. Remember to always keep breathing through the whole movement. Inhale and exhale all the way through, and come back to neutral. Nice. Okay, so now we're going to do a little bit more extension, staying from our 4-point kneeling, coming onto our tummy. We're going to do into the cobra or some extension through the back. Okay, hands by our sides. Okay, so we're going to pop our hands just alongside the chest there, and elbows out. So we're in like a nice L shape here. Okay, and my forehead is on the mat. Okay, so when you're ready, when we take the in-breath, remember here not to, as you draw up, okay, remember not to collapse through your tummy. Keep those abdominals on. We're going to in-breath to prepare. Exhale, little bit of pressure through those forearms and just extending up. Now, if you feel any pain in any of the exercises or it doesn't feel right, you stop that exercise, okay? Any pinching in your lower back when you're holding into the cobra, okay, you've gone too far. You might need to lower it down. So extending up through here and coming back down. In breath to prepare. Exhale. Extend extending up. Nice. And coming back down. So again, we're trying to get some extension through that back without releasing our abdominals too much into the floor and our pelvis. That's it. And coming back down. So we're just warming up the spine, releasing it in all directions. Last exercise we did flexion and extension, and now we're doing just extension. Got 2 more, and coming up. And coming back down. And last one, extending up. Keep those shoulder blades down too, don't hunch up, draw them down. And coming back down. Great. So now we're going to come onto our back. Okay, if you need a little cushion underneath your head when you're on the mat, okay, to support your neck, you can do that. Alright, so you might need a little cushion through here. So while we're in our neutral spine, through here we're going to do another little bit of movement through here. I'll just move my roller out the way. We're going to do some rotation now, okay, through the lower back. So what I want you to do is we're going to start with crossing our right leg over our left leg and popping our arms out to the side. Okay, so then we're going from here, we're just going to do some rotation. We're going to take it across, keeping this left foot on the floor. Okay, we're going to take it across to the same leg as we've bent up. So right leg crosses over and we're rolling over to the right. Keep breathing through, holding that. Come across, hold that stretch, and coming back to the center. And then we're going to go the other way. We'll come across to the left. Same, keeping that left foot on the floor, rolling through, holding that stretch. This one should feel quite nice to work through that lower back. And coming back to neutral, we're going to let this one flow. One movement, as soon as you hit to the end, keep your shoulders on the floor, okay? If you're taking one shoulder off, you've gone too far. And we're just going to go back and forward from one side to the other, really moving and articulating through that lower spine or lumbar spine to get it moving to rotate. Across to the side and back. Even when you're drawing back to the center, use those abdominal muscles to help you come back to the middle. Okay? Let's do 2 more. Taking it across. Keep breathing throughout. Over to the other side. I really like this one. This one I feel like you get a really good movement on both sides through that lower back. Especially when you're putting that upper back, keeping it put on the mat, you really feel the movement working through that lumbar spine. And coming back. Last time on this side, taking it across. And coming back. Great. Take that right leg back to neutral. Let's cross the other one over. So left leg's over. We're going to start on that left hand side. Breathe in to prepare. Exhale, let it fall out. So you should be feeling that on that right hand side now. Right through this area, through here, okay? Feeling it through that lower back onto the side, beside your spine. And over to the right. Bringing it across. And back to center. This one doesn't really matter if you're inhaling or exhaling at each movement. Just remember not to hold your breath. And back to the middle. And across. Remember, both shoulders are keeping firm on the mat. This movement needs to concentrate through that lower back and not necessarily through the upper spine. Okay, we're trying to keep that nice and still. And not tense up through those shoulders. And back to the middle. And across. If you feel you're hunching up, often in these movements, if you want to pop your palms facing up, that helps those shoulders relax a little bit more too, rather than having your palms down. Okay, it might just feel a little bit freer and help those shoulders relax. This is the last one, taking across to the left. And coming back to the center. And across. And slowly coming back to the middle. Great. Feet back to neutral now. Okay, back into our neutral spine position. Let's have our feet, knees and hips all in alignment. All 10 toes on the floor, hands by sides. We're going to do our pelvic bridging now, okay, to really warm up all the way through, again into flexion extension. Okay, so remember when we're doing our pelvic bridge, when we're exhaling, we're tilting that pelvis, tucking under, okay? The movement is like you're just peeling one vertebrae off the mat at a time to come into this diagonal. My hips are highest, followed by my rib cage, down by my shoulders. Okay, the movement through here isn't the feeling of lifting up, it's the feeling of lifting along, okay? So I want as much length out of my spine as I can when I'm up the top, and the same feeling for when I'm rolling back down, okay? Still keep lengthening out, feeling like someone's got those legs and they're pulling them to the other side of the room, okay? So we're trying to get that real stretching feeling as we're moving through our spine. So I'm going to take a breath in, and we're going to contract down, pelvis tucks under, slowly rolling up, coming up through to the top. Breath at the top, exhale, keep that length. So keep that pelvis and those hips all the way up right to the last minute. Keep your pelvic tuck and then come back to neutral. We've got 5 of these, okay? Hands by your sides. I'm just going to take them out to the side so you can see that pelvic roll up, okay? And tucking under. In-breath at the top. Start from the top. Upper ones come down first. Feel like you're peeling them back down one at a time. Lengthen out. Keep your pelvic tuck neutral. Got 4 more. Great, 3 more. Remember to have a feeling of those feet, the knees and the hips all in alignment, okay? Don't drop them out. We're really keeping them staying nice and neutral. Rolling up. And last one. And slowly rolling back down. Great. So now we've really warmed up through the spine. Okay, we've done all different movements through there, and we've really given a general roll and a general articulation. So now that everything's warmed up, we're going to start with a roller and do some specific movement through the legs. So remember, when we're rolling, our technique's quite important. We need to roll slowly. We need to roll along the muscle to begin to warm it up, and then we need to go across the muscle to really break up that restriction. So we're going to start off with everyone's favourite, the ITB, which is the side of the leg. Now, often people say to me, I can't do it, it hurts too much. You might, if it's hurting too much in here, in the class, just do a couple of times and then have a rest, okay? Because often it can be quite painful if it's tight. So we're going to start off, okay, Okay, I'm doing my right side, doesn't matter what side you do first because we always do both. Okay, so we're going to start off on this other side. I have my other leg in front with my foot down to support. Okay, so we're going to start right from the top of the attachment to the hip and we're going to roll it all the way down. Okay, so I start, let's stop a bit here. Okay, so I just come down to that elbow to help me support so I can move my way up and down. So I'm going to slowly roll through to the side, all the way. Okay, remember the slow movement is important. And coming back down, all the way. So we're going to go up and down about 3 times, okay? So I've gone up and again, slowly coming through. Now you find parts through the muscle that you find are quite tight. Okay, there'll be a little band. Okay, take that part that's quite tight, nice and slow. Okay, work your way through. Remember to be right on the side, don't cheat and go a bit forward or back. Okay, we're really taking it all the way along that muscle. And coming back along. And take it all the way down to the knee attachment. Now once I'm at the bottom here, I'm going to start my cross fibre. So I'm going to transfer my weight forward and back. I'm going to do that a couple of times. And then I'm going to move the roller up slightly. And I'm going to do that again. Forward and back. So you should feel yourself going across that muscle and really working through. And again. And across. Forward and back. Keep with it. I know it can be a bit sore. It'll be worth it. And come forward and back. That's it. And again. So I'm really getting right to the top now. Once I've reached the top, I'm going to come forward and back. I'm going to work my way one more time back down. Forward and back. That's it. And keep working down. Keep breathing through. If you find a really sore spot, just breathe through. Keep working. It's usually that sort of midsection about where I am now that's quite tight through there that you'll feel that real pain in that one. And again. So getting down to the bottom, nearly right through the whole muscle length. And forward and back. Nice. So it should start to feel nice and warm through there. I'm going to swap sides and the other side. Okay, same thing again. Have that support through here and I'm going to roll all the way along. So start coming all the way through, all the way down to that attachment. And again. And down. And slowly coming back up. Now one side probably will be tighter than the other. That's generally what the case is for most people. That one side will have a pattern that's a little bit more restricted than the other. I think it's my left. A little bit tighter. And working your way through. Let's go up and down one more time. So you can see how slow I'm going, okay? Even when you often see people doing it, they really rush it and they're doing it much faster than this, but we need to take it nice and slow to really work it through that range. Okay, so I've come back to the top. I'm going to start at the top here and I'm going to go forward and back and forward. Remember, go over that section a couple of times and then take it down a little bit and go forward and back again. Keep working your way through. And if there's one section that's pretty tight, and you feel like that needs the work, you can just stay on that one a little bit longer and just work your way through, crossing over that muscle fibre and working your way. So it takes a couple of minutes to do each muscle on each side, okay? So to do it properly, we really need to work our way through. And working down, coming down to the knee attachment. Keep breathing through. All the way down. So it's just transferring that body weight forward and back. If there's a lot of pressure on your arms or your shoulders, and you just take a little break. Okay, just pause the video, take a little break, give it a bit of a rest, and then continue on. So I'm working my way back up now, back up to that hip attachment, working my way through, right up to the top. Work your way, nearly there. Okay, great. Nice work. Excellent. So we've really warmed up those sides now, take it all the way through. So now we're going to do the front, okay, through our quads. So what we're going to do is lay on our tummy, okay, both legs on. So again, we're going to go up and down and across the muscle fibre through there. So we're going to come onto our stomach, okay, and we're going to do the roll starting from right down the bottom there, and then coming all the way up, okay? Rolling up and down. So right from that hip attachment, using my elbows, coming all the way down. So really working along that muscle. That's it. And again, nice and slow, working your way through. That's it. So once we reach down to the bottom part of our knees here, we're going to go across the muscle, okay? Working the way across. Now with this one, you might feel that little bit of a flick. That's okay. We're going across that muscle. That means you're really going over the fibres. Okay, so transfer those hips from left to right and work your way across those quads. Once you've done a couple of times, just slowly work your way up. Work your way through, crossing over, going across, that's it. That clunk clunk feeling feels a bit yuck sometimes. Just hang in there and stay with it. Keep going. So I'm working my way up towards that top attachment through my hip. Right across. I reckon this one's a great one. Really feel like it warms it up. Really warms up through there. And you should feel that blood flow coming in. I almost think in between treatment times, this sort of thing is like having a little massage between when you have a treatment. It's a great thing to keep going with and try and get into a routine of doing, because it really helps release all those tissues. So now I'm working my way back down, all the way through, working across, all the way down. Remember, take it nice and slow. Take it right from left to right. You're doing really well. All the way to the bottom, just above that knee. Couple more. Great. And coming off. So now we should really feel that we've warmed up those fronts and warmed up the side. If you want, we'll give it a little rest for a moment, and we're just going to do a little bit more of a stretch on that sacrum. okay, with the roller, and then we'll continue on with the backs of our legs through our hamstring and calf. What I want you to do is grab that roller underneath now, okay, and we're going to come on top of the roller, almost sitting on the roller, and the roller's going to be on that bony part, or your sacrum, across here, okay, across your pelvis, not on your lower back, but across that bony part that you can feel when you're on that roller. Okay, we're going to keep the roller onto that bony part, okay, and we're going to bring our knees up to here, okay. You can use your hands just to support so the roller doesn't pop out the other end, okay, and then from here, we're just going to do a little bit of massage through that sacrum where we're going to take our knees over to the side, and then coming back to the center, and then again over to the side. So we're just working our way through, really feeling that myofascial release over the sacrum and all the attachments through that muscle. Okay, keep breathing through. So this one should feel quite nice through there. Okay, really taking it across. Right on that sacrum part. Good. Try and keep those shoulders down. Just take that movement as far as you feel comfortable from left to right. Great. Taking it across. Now from here we're going to do back to the center and just do small circles with your knees, taking it up to flexion, out to the side, a little bit of extension. But again, the roll is still on that sacrum and the pressure through there as you take it through the rotation. Take it round. All the way through. Good. Let's do 5 and 4 and 3. If it feels a bit unstable, you can just make the circle a little bit smaller, okay? Just as long as you're taking it through that movement. And back to the center. Let's go back the other way. Rotate through the other way. Keep breathing. Keep that nice flowing movement all the way through. It's nice. This one should feel pretty good too. Doesn't hurt like the other roller one. Really warm it up. That's it. Take it through. And take it back to the center from here. Let's just drop one leg over that part with you still on the sacrum there. Hold on to here and just let that stretch over, okay? Give that front that we've just rolled out a nice big stretch through there. Let it hang off. That's it. Let's hold that stretch. 3 deep breaths. That's it. And keeping that stretch out. Let's swap sides there, taking the other leg up, bending that in and stretching that other leg over the roller. Let it hang, feel it nice and long, letting it relax, reaching out. That's it, keeping it in. Great. And bring it in. Okay, take that roller just out for a moment while we come and sit up. Okay, so now we're going to come and sit on the roller through here. So again, the roller is going to be onto that, right on those sit bones, okay, that bony point through there. And we're just going to take our legs out just as far as comfortable, okay? So wide through there. All right, just as much as you can while sitting on the roller. So we're going to take, say we start with our left arm through here. So we're just going to really press down on that part of the sit bone and really reach across, okay, to try and lengthen out through that hamstring. So quite neutral through here, and I'm just going to take it across to the other side. Try not to lift that pelvis on the opposite side to come up too much. We're just trying to reach across to our toes, okay? So you should really feel that coming underneath in here and lengthening down. So I have got a bit more pressure on that ischial tuberosity, or the bony part on this side, and I'm really lengthening out through my leg and taking it across, okay? Holding that, and we feel that stretch through there, right through the back of that leg and that thigh, holding through there, and coming back up, and through this side, and holding, that stretch. So really should feel that nice lengthening and that real, not too much of a pull. If it's a sharp pain, you need to back off a little bit, okay, but otherwise keep with that nice stretch through there. And making sure that you're not hunching over through that back, keeping upright and coming up. Nice. So now we're going to come, we're just going to, I like the spiky ball through my hamstring and my calf, okay, rather than the roller, because I feel like I get more out of it. So what I want you to do, and finishing off, is just taking it through all those points through your calf, okay, so you're just rolling up and down, really working your way through like we did. The spiky ball, so for the foam roller we go up and down and across. The spiky ball, it's the same thing. You can go up and down and just work your way through all those tight spots that you can get, and just hold on there. So you can really work into any little tight or contracted spots through any of these muscles to get into it. So I think through the calf, and then again through the hamstring, okay, you can really get in a little bit more specifically than you can with the roller. All right, so I would just, to finish off, we're just going to like work our way through that hamstring, any tight spots that you find, working all the way down that leg, and then working into the calf, okay, through here, and working in those spots. So rolling it round and taking it right through. And so after the fascial release today, those legs and even through that lower back, I'm going to swap sides through there, should feel nice and warmed up and loose, okay? So something like this is something if you can get into, I know that was over half an hour, it might be a bit hard to do every day, but if you get, you know, a little 10-minute routine of the things that you find help release it the most, or do your foam rolling on your legs every day, that will really help release all the way through your lower back and through your legs. So continue on if you need a little bit more time with that, the calf or the hamstring, or you want to go back and do any of those ones we've done today. They're great to keep you moving, you know, keep going all the time. So have a lovely day, stay well, and we will see you next time. See ya, thank you.